Welcome to the Huxley Morton Podcast. This week I am joined by Surabhi Sharma, Director and Project Leader of Sanofi, who's going to be sharing her story about moving up in the world of pharmaceuticals and from one country over to the States. It'll be interesting to hear how it's all worked out and the cultural differences. Surabhi, you and I have spoken just recently, as we're on the lead up to the Christmas. So for anyone listening, it is the 16th of December. But give us a quick introduction about yourself, what your role is at Sanofi, and I guess a little bit about your background.
Absolutely. So currently, as you have kindly introduced me, I'm the project leader of clinical sciences and operations in diabetes and cardiovascular divisions of Sanofi.
Yeah.
So just to give a quick idea, I oversee 5 compounds and in different phases of development, clinical development, all the way from some just starting in phase 1, all the way up to some as advanced as having a bunch of phase 3 clinical trials, large global clinical trials, and ready for NDA or BLA submission.
Okay, so how did so that's your current role, and that's what you're now up to. But look, before we dive into that and some of the exciting things that have been going on in your world over the past, say, 9 months with the outbreak and things, let's first rewind right back, because when I first reached out to you, is because I saw some of the voluntary work that you do, some of the master's degrees that you had picked up over the years. So look, I know that you got your first master's degree back in India. How did you end up going from that and to move into the States, to getting into the world of pharmaceuticals and clinical trials?
Yeah, it's been a long, interesting journey. You don't want to get me started with a 10-hour story, but what I can quickly summarize is I did my first master's in India from the premier institute in India, Indian Institute of Technology. Yeah. At that time, it was still called University of Turkey. And that was in biotechnology and biosciences. And then I decided to stay over and started working as a research associate or a project fellow in structural biology. And the more I worked in structural biology, the more I got interested in research. And, I started applying for higher education in structural biology. So at that point, I applied to some Indian institutes also, and across the globe. And at that time, it was, there were very few institutes in India that were specializing in structural biology, especially my area of NMR. So that is why I was applying elsewhere across the globe also. So it so happened that I was accepted at University at Buffalo with a full fellowship, and which meant I didn't have to do any graduate assistantship or teaching assistantship, and I could focus completely on my research and on getting a PhD. It was a master's PhD program. So I came halfway across the world to Buffalo to get started in my master's PhD program. And at that point, I was very siloed, and I was basically working on wet science labs. And at one point, one of the deans in Roswell Park Cancer Institute, where I was working, which is affiliated to University at Buffalo, he sent out a very interesting long email to all the students that there is a whole wide world out there. You can do a lot of things, even with PhD, without PhD, even with a master's. And he opened my eyes to, just because I decided to be in a silo doesn't mean I have to be in a silo.
Yeah.
At started, asking questions. What happens once we make a great drug in the wet lab on the computer? Great. On our petri dishes, it looks great. So are we ready to give it to the patients? And my supervisor at that point said, wait a minute. There is a whole area called preclinical research where the drugs are tested on animals. So we can't just keep, once we have a good drug on computer, on petri dishes, that doesn't mean you can give it to the patients.
Yeah.
Got interested, took some courses in preclinical research, and moved to University at Michigan at Ann Arbor to get into preclinical research. It still had a lot of NMR. I was also introduced to the field of MRI. I was working on oncology drugs, drug testing. And again, curiosity got the better of me at some point, and I asked the same question. So what happens after this? Are we ready to give it to the patients? And my then supervisor introduced me to clinical research and said there's a whole component of human testing before the patients can have it.
Yeah.
So I was very curious about it. At that time, I also got married and moved to Greater New York area, and I started taking some courses at Rutgers University to learn about clinical research. But the jobs, when I was trying to find a job in preclinical research or even in clinical research, the jobs in clinical research were not very forthcoming. It's the catch-22 situation, always, because if you don't have the experience, you won't get the job. But if you don't have the job, then how do you get the experience?
You're preaching to the converted there. As I say, I run a recruitment business, so I know all too well the struggles for job seekers on that side of things.
Yeah, so although I had a lot of research background, but no one was ready to give me the first starting job in clinical research. And I was just applying for a clinical research coordinator position at any of the hospitals in the area. So since it was not going anywhere, I started talking to some of my friends. They introduced me to some other people who became my mentors and have been lifelong mentors. They suggested, why don't you volunteer pro bono and get some experience if that is the only handicap you're facing? So I thought that was a good idea. If nothing else, I'll get some experience in something new. I'll learn something new, and then maybe keep on, trying to find jobs in preclinical research.
And it's such a good way in. I mean, we're always giving advice to aspiring research coordinators, research associates, and that's the one thing we say to all of them. That if you're struggling to get in, look, you do need to stand out somehow, and it may be that you've got a unique personality, in which case use it. Maybe send a voice message to a hiring manager, a video message. But if you're not comfortable with that, then look at voluntary work, build up your CV, because all you need is that foot in the door. And it sounds as though that's kind of the route that you went, right?
Yeah, absolutely. So I was looking for volunteer positions also, and not getting much traction till I found an associate professor in University of Medicine and Dentistry of New Jersey in Newark, who was looking for someone to crunch his data on functional MRI. And that was, functional MRI is all human research. But he was struggling to find someone who could help him crunch all that, big data. I had that experience of having been worked in MRI and NMR before, but I didn't have any experience in human research. So it was a win-win situation for both of us. I went there as his data manager, if you can say that. Working on his big data, trying to work on the algorithms and trying to crunch all that data the way he showed it to me. And in return, I had the opportunity to at least observe how clinical research is done, how, a consent is taken, how to handle patients, what kind of data is collected, what is a protocol. And that experience was really good. I did that for 6 months, but that opened up, people's mindset, and they started looking at me as someone who could do clinical research. So within 6 months of volunteer work, I was saleable.
Amazing.
And then I got my first clinical position, clinical research coordinator position at Mount Sinai. So that was the journey.
I can imagine. And look, I know all too well, I guess, just from starting a business myself, I know that the first 6 months, it was awful, really. I had these big ideas of how it was going to go, and, making loads of money as I had done at with the previous employer. And it wasn't like that at all. It was so much harder than I ever thought it was going to be. And I think when you and I spoke the other day, I was just highlighting just how close I was to almost jacking it in, because it just wasn't financially even viable. I had a mortgage to pay. My partner and I were thinking about having children, and it just we came so close to almost just giving it all up because it was tough. And that's the, I guess, the one struggle that perhaps people at that stage maybe also are facing. So how did you manage to cope with working unpaid without having any guarantee of what was to come?
Yeah, so it was a leap of faith, if I can say. No other word can justify that. I was working for those 6 months in pro bono position. My husband at that time was working as a postdoctoral fellow in New York City at a prestigious institute. And we had to keep the food on the table. We had a newborn at that time, and imagine, one person's salary was not enough to get the kid into the daycare and put the food on the table. So especially when I was working as a volunteer at UMDNJ, I literally had to come up with, thinking outside the box kind of solutions. For data crunching, I negotiated with my supervisor if I could start later in the day.
Yeah.
And that was because between me and my husband, we used to stagger our time slots. So he would go to work in the city, in New York City, 6 a.m. he would start his work. So he would start really early. And by 2 p.m. he would be back home. And I would be literally standing at the door to hand over the baby to him because we couldn't afford the daycare. I would be standing at the door, hand over the baby, and drive off to be at UMDNJ Newark campus, to be there at least 2:33. And I would start my work at 3 and go on till 9, sometimes even later.
Wow.
And Newark was not a very safe area in those days. I'm sure it's not a safe area now also. Some areas are not safe. So it was not a safe area. To be driving alone in the middle of the night, sometimes 10 p.m., 10:30, was not, very appealing to anyone. But that's how I did it. I mean, at least I could see some human clinical research interaction from 3 p.m. to 5. Yeah. And after that, I would be doing my data crunching, sitting alone in the lab, and then to drive back home.
Wow.
And even after 6 months, when I got the job, because I was an immigrant, I needed an H-1B. I had an H-1B before at University of Michigan when I was working in preclinical research, but since I had to take a break and I moved to Greater New York area, whatever institute needed to hire me, they would have to have a transfer of H-1B, and at that point, not even a transfer, a new H-1B needed to be sponsored for me.
Yeah.
That's not a fast process. Even if you expedite that, it could take a couple of months. So we were struggling there. And, my supervisor at Mount Sinai offered that I could start work immediately, but he won't be able to pay me without the visa.
Wow.
And at that point, it was a difficult choice. Do I give up this position because I don't have the money to commute to New York City, because I don't have the money to put my baby in a daycare, or, be transparent to him and, again, think outside the box, see if there's any alternative that can be offered. And that's what I did. I was very open and transparent. I told my supervisor I would love to start tomorrow, but I have some limitations. I don't have money to commute every day from New Jersey to New York. I don't have money to put my son in daycare. And there's no way you want me to stagger as my job with my husband in clinical research, because even traveling from New Jersey to New York would take more than an hour. So you wouldn't want me to start later in the afternoon. It's not like a data management job where I can sit alone in a lab. So he understood. He was very open-minded, very sympathetic. I believe everyone has gone through some adversity and in their earlier lives when they are setting up themselves. Yeah. I'm sure he had to. He could relate to it, and he said, okay, I cannot give you the money for your daycare, but what I can do is I can at least give you the employee pass to commute from New Jersey to New York. It will be all paid by the institute. At least that will help you. Now, I don't know how you're going to get, the money to put your son in daycare. So again, I tried to stagger at least half of my day with my husband. And that way we were only paying half day of, daycare, which is very expensive in US. And
I know it's much the same here in London. I don't think that will ever change.
Yeah, and we exhausted all of our savings, and we also had to borrow some money from our friends. But at that point, it was basically a leap of faith. I didn't know if it was going to work out. I didn't know if I would get the H-1B. Even before that, when I was working pro bono, I didn't know if it would really lead to any kind of job in the area that I was trying to get to. But at some point, you have to take some calculated risk, and that was my calculated risk, which paid off.
Well, look, it's an amazing, as you say, leap of faith. And I think that so many people have done that. And that's what I'm always giving advice to, people that are either coming through the ranks with us in the recruitment world or looking to get into clinical research. I'm very open and transparent with my own sort of stories as well, because as you said, most people have had some form of adversity that they've had to come through. And I think that transparency is everything. And that's one thing I've always prided myself on. It's just being very open, easy to deal with and transparent, because I normally find that if you're open and honest with people, naturally people want to try and help. People don't want to close you down. And, clearly your manager at the time saw that you were a great individual to have on the team. And if it means bending a few of the norms, why not do that? For me, it just makes complete sense.
Exactly.
So it sounds like there would have been, a lot of challenges at that time, including sorting out the H-1B and just perhaps just differences to what you were used to from, coming over from India prior to this, so it's a different working world. What other, I guess there was perhaps different cultural differences that you experienced at that time when you were sort of new to the States. Tell me about, because this we didn't cover when you and I spoke earlier, but I always do speak about the cultural differences when I'm speaking to staff working all around the world. What was some of the unique differences that you noticed from India to the States? Because sometimes it's quite fascinating to hear just little things that go on in certain countries, and you just never know, and it's just must be such a change.
Yeah. it is a huge difference, especially if you are the first to migrate in your family. And on the professional end also, if you are coming from a country where you were a citizen, you never had to think about visa situation, you never had to think about going from one job to the other, how you're going to manage that, and if the receiving company, the receiving manager would be open to giving you a sponsorship for the visa. It's definitely more relaxed when you are a citizen of a country. You can jump jobs, jump ships very quickly. In terms of professional experience also, I have a great story, and that's why I'm giggling almost because 1 year after coming to US as a student, and I was working full-time, and I was a full-time student also. At that point, I went back to visit my boyfriend, and he was also doing PhD in India, and I was doing PhD in US. But there was so much of a change in the work styles that I just couldn't imagine how much I had changed in that 1 year. Because I was being paid a full fellowship, because I was on student visa. There was a lot of commitment, I think. And the work culture in US is you work like crazy from 9 to 5, 9 to 6. And especially if you're working in labs, sometimes even later. You go late in the evenings, late in the nights. So that is how I had, started working. I used to work endlessly, 24/7. I'd become a workaholic almost. And when I went back to India to visit him, and what I saw was, it was a very relaxed culture, even for PhD students. I mean, he was doing PhD in a premier institute in India. And it was much more relaxed. They would, there was many more friends. They would go out for coffee. They would go out for lunch together. Not that we were not doing it in US, but the lunches were extended. And I was getting to a point where I was getting frustrated, even staying with him for a couple of weeks. I was asking him, why don't you work? I don't see you working. He was telling me, but I am working. Oh, what don't you see? I'm working. My PhD supervisor is very happy with my performance, with my results, with my experiments that I'm setting up. I'm setting them up. And he used to work later in the nights also. But it was much more relaxed. And, it almost felt like there was no tension, no anxiety. He was working very effortlessly whenever he wanted. And on the other hand of the spectrum, I was working like crazy because I'm trying to...
100 miles an hour.
I'm trying to work on that visa. I'm trying to work on that fellowship before it is exhausted. And God forbid, if my PhD doesn't finish by that time, then what will happen? So there was always a constant pressure on my head to, finish quickly.
Wow. So, I mean, there's certainly some differences in the culture of work there. I guess there would probably have been some of the obvious, I guess, in terms of the weather. I mean, us, I'm British, love talking about the weather always. The food and things, because this we recruit all around the world, so these are the things I hear from people. It's normally, okay, what's the location like? If someone's traveling with their wife, they want to know what facilities are there, or what the weather's like, what the food's like. I guess that was perhaps another area that was
absolutely
difference between the States and India.
Right. So, wherever you belong to, you have a certain food habit. You like to try out different cuisines, but eventually your soul food is your own food, right? So, so I was always craving for Indian food, and to find Indian food, we had to go to. As a student, it was difficult to go to very distant Indian superstores, right? And they were far and few, and we had to change a couple of buses, and in the middle of the snowstorm, go there to stock up. So that was the other thing I found was challenging because, I couldn't afford to eat out every day. I didn't want to eat out every day also because I wanted my Indian stuff. So that was another part that I always had to make time to cook for myself, at least for a day or two in advance, so that I had enough food when I got back from lab later in the evening, later in the night. Meanwhile, as I was just saying, when you go back to India to see your boyfriend, there was so much food around him. All the cafeterias, all the canteens, you could step out anywhere. There is all sorts of different foods, not just Indian food, but all sorts of different cuisines that you can try. So he didn't have to think about, cooking and cleaning and keeping your fridge stocked up. Those were some of the extra burden that you always needed to schedule in your timetable.
So you felt that he wasn't working as hard, and he had all of this food cuisine on his doorstep as well.
Well, yeah. So that's something people forget when they move from one country to the other. That's another thing you have to think about. There will be cultural changes. Your family support is not there. Your friends you're leaving behind. So you have to make new friends very quickly, build your own support system, and then be able to, quickly adapt to the new place. So you can't expect to be eating Indian food in the middle of Buffalo all the time. And on top of it, I'm also a vegetarian. I've been brought up as a vegetarian. So that was also an added thing to consider, because even if you step out to a restaurant and think that you can, buy food somewhere, it was difficult at that time to find vegetarian food. So those are the types of cultural additions that you have to think about when you are moving halfway across the globe.
Sure. Now I can imagine the difficulty with that. I think, these days finding vegetarian and vegan food is very easy by comparison. But certainly, maybe going back 10, 15 years, that wasn't the case.
Exactly.
So look, that's talked us through some of the challenges, the hurdles. It's, as you said, you were the first from your family to emigrate from India, and I know. That you were quite rebellious in doing that. So, but it sounds like you've always been very headstrong at doing what you want to do and making a success of it, with the childcare and being very transparent. And then that takes us up to the point where you landed a job in clinical research. And then from there, it seems, if anyone looks at your profile on LinkedIn, it's almost like things have just exploded for you since then. You've been with some of the biggest players in the world of pharmaceuticals, and you've progressed through the ranks to the point where you're now managing a whole variety of sort of programs and projects. Just talk us through in a snapshot how that progression, because it's almost kind of textbook, isn't it, where you went from coordinator to associate and then sort of up the ranks. Just talk us through that and what advice you would maybe give to any of the people that are just getting into clinical research and want to follow in your footsteps, because that's kind of what the podcast is about. It's about your story, but also a few tips, tricks and advice for those maybe following your footsteps.
Absolutely. So although it looks like a success story after that, but it's not been that easy. Every day you run into challenges, you run into issues, personal, professional, bringing up kids. in a foreign country itself requires an extra effort and extra time on your schedule. Plus, you have to navigate your professional life. So it wasn't easy, but I've been a perpetual optimist, and if I'm going through a trough, I know that it can't go through. The rest of my life is not just a trough. At some point, I'm going to come up. It's a sine wave, right? So that's what I believe in, and I just keep plugging along, and I'm like, okay. So when I started as a clinical research coordinator, and did that for a few years, I was about 25% of my work was investigator-initiated clinical trials, where I would be supporting my physicians that I reported to, and I had multiple physicians that I reported into. Brilliant minds, they would scribble on the back of an envelope based on mechanism of action of a compound. It could also work on XYZ disease. Why don't we try that out? And basically, I was responsible for taking that envelope and putting together a whole clinical trial. So writing the protocol, getting the regulatory approval, getting the approval from the pharma company that produced that drug, to get the drug material from them, maybe if possible some grant from them, designing the CRFs, writing the ICF, getting the ethic committee approvals, and then collection of the data, and all 9 yards till the writing of the clinical study reports. That taught me a lot. The other 75% of my work was pharma-sponsored clinical trial management, and that it was good in the sense that it was already fully baked. The protocol was there, the CRFs were there. I just had to manage a whole lot of them from different sponsor companies, but it taught me, the interaction, what goes on at the pharma side, at the biotech side.
Yeah.
And then very quickly, because Mount Sinai has a very unique system in clinical research, they have collaborations with some independent clinics all across the New York City. These are strictly independent clinics with their own clinical research staff, but only for clinical research, they collaborate with Mount Sinai. So, my supervisors saw my potential in leading a group, and I was quickly made almost the manager of the different clinical research coordinators from these independent sites. My job was to keep them all audit ready at any point of time, help them, understand the protocol and make sure that the recruitment was going on nicely. So that is what I did. But I used to interact a lot with the pharma companies because at the investigator meetings or the CRAs that used to frequent, the auditors that came in. So someone just told me, why don't you try it out in pharma company? And that stuck in my mind, and I decided, well, no harm in trying. My supervisors in the hospital and at Mount Sinai, they were not so happy. They were telling me, why are you trying to go to the dark side? You're doing so well here. Why would you want to leave all that and start from scratch? Well, I'd already started from scratch 3 times in my life earlier when I left everything in India, came to US for structural biology research and PhD. And the second time I started from scratch was in preclinical research. And the third time I started from scratch was in clinical research. So I wasn't afraid of starting from the scratch, going to pharma side, just to explore. So I have this curious mind where I like to explore new areas. And that took me to pharma side. I went to Merck, who was at that time looking for a person who had a lot of experience in investigator-initiated clinical trials. So I joined Merck. It was a short-term project, only 3-month contract. It was a huge risk. I was told if they don't extend your contract or if you don't get another job, what are you going to do? And remember, I had a break in my professional life and I moved from preclinical to clinical for about a year, from Michigan to Greater New York area. So it was very fresh in my mind. So I hesitated just a little bit, but then I decided, well, again, leap of faith. We'll see where it takes me. If nothing else, I'll come back to any one of the hospitals. Now I have much more experience as a clinical research coordinator. There's no reason why I cannot come back. If nothing else, maybe I'll try for preclinical research again. So I decided to take that 3-month contract at Merck and never looked back.
Amazing.
Since then I've been here.
And then from then, I guess at that point things did, start to progress and take off. And then I guess, you've now been in clinical research for many years. You've been very successful, and you're now sort of a director and project leader for a very big and well-known firm with in terms of Sanofi. But what challenges and whether it's been staffing of your trials, furlough, working from home, what sort of challenges have you faced, both on the business front and perhaps personally, dealing with working from home over the past year since the pandemic broke out? Yeah,
it's another interesting time that right now we are going through, where a lot of us are forced into working from home or working remotely. I remember when I started in pharma, it was a very junior position. I was just a coordinator, a specialist in investigator-initiated trials. But there was no flexibility in those times, even in that junior position, which was all computer-based, to work from home. So I was literally commuting 50 miles one way, meaning 100 miles every day to get to work and come home. And, that was the condition. You can't work from home. There was no remote working at that time. So literally, you had to do that.
Yeah.
And then as I progressed, in other companies, I started seeing some flexibility. As time went on, the flexibility increased. I guess people were getting more and more comfortable, but still not to a point where, for most positions, it was still that they were office-based. It's only because of this COVID-19 pandemic that we have seen such a huge number of us are working 100% remote. So, but even in the times when I was still, a research coordinator and working at Merck, I would always question if most of my work is going to be computer-based and I have a laptop in my hand. Yes, it used to be a very heavy laptop in those days. But if I have a laptop, how does it matter whether I work in the office completing my data entries, or whether I sit in the Central Park, or I sit at my home? And at that point, no one was listening. But now this is the largest, I guess, data test that we have survived for last 9 months. All of us are literally forced to work from home, at least a good 80 to 90% of us in pharma companies.
Yeah, definitely. Well, look, what are your thoughts on, I guess, 2021, the vaccines, working from home, decentralized trials, et cetera, et cetera? I mean, for me, I like working from home. I mean, we've been set up for it for a while. My teams absolutely love it. I actually get, almost, I think, more out of them just by giving them that trust rather than looking over their shoulder than what we've ever done.
Right.
It's been great. But what are your thoughts on say, the vaccines and what's in store for us in 2021?
Yeah, so this week has been a momentous week. We heard that in US, Pfizer vaccine is coming out and the first person has been inoculated. So great work. I mean, I have not worked in vaccines. I would love to, but I can say that this whole fast forwarding of the clinical research process, which used to take 10 to 12 years to get a vaccine or even a good medicine out in the market, has now been shrunk into less than an year. I'm not sure how sustainable it is going to be in all disease area, in all therapeutic areas, but I'm hopeful that this will stick now. If not, as much as going from 10, 12 years to 1 year, at least if we can even half it, that would also be a great achievement. So the silver lining on COVID-19 pandemic, I think, is for clinical research, it's going to bring a lot of streamlined processes, very expedited processes, which is always good for the world, for our patients, and also for the companies, because if they can get the drugs out quickly, they also get to make more money, right? So I think it's going to be really important to keep up with this trend and to try to duplicate it in different disease areas. Some of them, oncology maybe, is going to be difficult. Maybe even some more are going to be difficult. But let's try to strive to, compress the timelines. We have been making only small progress over the last 10, 20 years, but this has been, a game changer, if you can call it. COVID-19 has literally brought us to our knees to understand where we can expedite our processes. So I am really hopeful that this trend would continue and in other therapeutic areas also.
And I think the awareness that the pandemic has brought to the industry and to clinical trials has been amazing. I can now speak to my peers and my friends outside of work, and all of a sudden they understand kind of what we recruit into. They've understood the engineering side of the business for years, but now when I say clinical trials and etc., they're like, oh, that's what you do. I'm like, yes. So it's I think that has been a great side of things. So look,
I also feel that now that we have a greater understanding in out in the world about clinical trials, now is the time where iron is hot. If we really promote clinical trials, because pharma industry, clinical trials, human testing has had some black botches in the past. This is the time to redeem ourselves. We can really, play it to our advantage to say, look, without clinical research, we couldn't have done this. It's almost like a miracle to bring 10, 12 years of research into one. And without our patients, without the volunteers who participate in these clinical trials, it would not have been possible. So if we can, I don't know, advertise is the right word, but if we can advertise it, a lot of the therapeutic areas might be able to benefit from this, because now this bad reputation of participating in human clinical trials could be wiped off, and we could benefit out of that.
Yeah, just almost break that stigma of people participating as almost lab rats, as it may be.
Yes.
It's kind of, once that goes and it's like everyone working together, hopefully that movement will just bring bigger and better things and faster results for everyone, I guess, around the world. Which
exactly.
But look,
one of the longest pieces in clinical research was the recruitment in clinical trials, especially large clinical trials. And a lot of therapeutic areas, a lot of clinical trials struggle there. So this might be something that we can use to, educate the masses that this is a good thing. You're doing a service to not only yourself, your friends, your family, but to the whole humankind by participating in these clinical trials. And it comes with a responsibility, obviously, that we have to show that we are working very ethically and we are clean and we are not going to repeat some of the past bad experiences.
Definitely. Look, I know that you're a big advocate of helping others. I know you do volunteering work. You act as a mentor to those that you work with as well. I don't know where you fill it all in sometimes by, from our conversations, but outside of the world of pharma, again, just give us a quick snapshot of yourself. I mean, what do you, for me, I'm big into sports. I quite like cooking and food and things like that. What are your interests outside of sports? What would you be doing if you hadn't maybe made that jump from India over to the States and gone on that crazy path of yours to where you are now? What would you be doing outside of this, do you think, Surabhi?
It's hard to say. I'm a very avid globetrotter. I
Yeah.
love traveling, trying out different cuisines, trying out, different cultures. So that probably I would have done that. I would have been a globetrotter. And now in the last 10 years, we have seen a lot of, travel blogs. But in those days, there was nothing travel blogging, but it was travel writing. I would have been a travel writer, maybe.
Yeah. Nice.
I still like to travel a lot with my sons. I have two sons. And the other thing that I'm very passionate about is helping others, whether it is career coaching. So I'm also a career coach pro bono most of the times. I've been doing that since I was in my first master's in India. People came up to me and asked me for advice, and I acted as a sounding board, and that has continued. The biggest testimonial is that I've never advertised a lot about it. Just a word of mouth from people brings others to ask for advice. And people that I have worked in the past still keep in touch with me, still ask me for advice. People that have never worked in the past, just referred by someone else, still keep giving me repeat business. So something that I'm doing there, I'm doing right.
Yeah, no, it's similar for us as a business. Our business grows pretty much all on referrals. You do a good job. You be transparent, as I said earlier.
Right.
I think that just creates a continuous cycle, and it's good for everyone involved. But look,
I'm also a food blogger on the side because
okay.
I love to try out different
blogging,
cuisines.
but you are doing the food blogging.
Yeah, so I like to cook different cuisines, learn from my friends from all different cultures. But nowadays, YouTube has become my biggest, teacher. And then I try to make those traditional recipes, which used to take, sometimes days to make. As a scientist, I'm always putting my hat on and thinking, how can I do the same cooking from scratch, but compress the timeline? So imagine the vaccine timeline going from 12 years to 1 year. That's constantly on my mind when I'm looking at some traditional dishes, whether it's Italian or Chinese or Indian, that used to take like days of preparation and bringing it together and, cooking it. I've successfully done that for a couple of Indian recipes, a couple of Mediterranean recipes, Italian recipes. So I started my own food blog on how you can compress your timelines and still cook from scratch with the same results. You're not compromising on the quality and the taste.
I like it. Surabhi, it's been fantastic having you on the show. I'm sure that there'll be people that are interested to either look you up, reach out in some way. What's the best way to find you? And including that, perhaps a link to the food blog. So what's your food blog called, and how should people perhaps reach out to you if needed?
Yeah, so my food blog is Surabhi's cookbook.blogspot.com. So SurabhisCookbook.blogspot.com. Professionally, you can always contact me on LinkedIn. You can send me an email on my personal email, sharma22surabhi@gmail.com, SHARMA number 22 SURABHI@gmail.com.
Perfect. That is all very good. Well, I guess I'm sure there'll be some people checking out the food blog. Others may well want to reach out for some tips and advice on a professional level. But look, Surabhi, it's been fantastic having you on. Thanks very much for sharing your story. And look, you and I'm sure we'll keep in touch, because I'll be interested to see what 2021 brings for you and your team at Sanofi.
Perfect. It was a pleasure. Thank you.
You are welcome. Thank you.